performing the small volume nebulizer treatment. I will first verify the physician's order for the appropriate medication that I will be giving, dosage and frequency, which will be 2.5 milligrams of albuterol into 3 milliliters of normal saline solution every 4 hours. I would also review the patient's chart for any significant findings, such as allergies. I will now wash my hands for at least 15 seconds and apply gloves. Hi, my name is Tanika. I'm from Respiratory Care. May I please have your name and date of birth? Okay. Well, I'm here to give you a breather treatment today, okay? Okay. At this time, I will measure the patient's pulse, respirations, saturations. I will assess the patient's color, level of dyspnea. I will also assess the patient's breath sounds and note any unexpected sounds by loads and segments. I will now be assembling my aerosol delivery device, which is the gas source, the flow meter, the small volume nebulizer, the tubing, and the mouthpiece. I will now be adding 2.5 milligrams of albuterol into 3 milliliters of normal saline. Every 4 hours. I am now attaching my small volume nebulizer tubing to the flow meter, which I will turn on, and I will adjust it to 6 liters per minute. If there was not enough aerosol being produced, I will adjust the flow meter to 7 liters or 8 liters per minute. I will now ask the patient, may please hold your mouthpiece. Okay. May you please be normal. Taking a nice deep breath. Hold it for 2 to 3 seconds. Now exhale. At this time, I will remeasure the patient's pulse, respiration, saturations. I will assess the patient's color, level of dyspnea, and breath sounds. If there was an adverse, I will stop the treatment. I will stop and discontinue treatment if there is an adverse reaction, such as a heart rate increase 20% above the baseline. And notify the appropriate personnel. At this time, the breathing treatment is going fine, so I would wait until there was no more aerosol being produced, and when that is, I would ask the patient, may I please have the breathing treatment back. I will turn off the flow meter. And I will now remeasure the patient's pulse, respiration, saturations. I will assess the patient's color, level of dyspnea, and breath sounds. And note if there is any unexpected sounds by loads and segments. I will instruct the patient, may you please sit up for me? Nice. And I'll ask them, may you please cough for me? Good, cough it all up. I will now wash my hands again for at least 15 seconds, and I will document in the patient's chart.